should vets have a voice in the assisted dying debate? Now, some believe that our experience in assessing suffering and advocating for humane treatment offers really valuable insights. And we are uniquely positioned to evaluate quality of life without the emotional and cultural biases that often influence human medical decisions. Welcome to The Consult Room, the podcast where we explore the evolving world of modern pet care. I'm Dr. Paul Mactolo, a UK veterinary surgeon with a deep passion for pet health and welfare. In each episode, I'll be exploring key issues, challenging perspectives, and offering expert insight and practical advice. Because ultimately, my mission is to improve the lives of pets and the people who love them. Before we get started, a heads up. Today's episode contains themes of euthanasia, both in an animal and human context, so please take care when listening. So today we're diving into a highly sensitive and thought-provoking topic, the Assisted Dying Bill, which is currently under debate in the UK Parliament. Now, you might not be expecting this subject at the Consult Room, but since veterinary surgeons like myself are very experienced in the field of euthanasia, it is, after all, a core part of our jobs. I wanted to share my insights on this complex issue and to explore whether veterinary professionals can offer valuable perspectives to the wider discussion of assisted dying for humans. I'm going to take a closer look at the key provisions of the bill, discuss the ethical considerations from both veterinary and medical perspectives, and consider whether vets can contribute to this debate in a meaningful way. So the Assisted Dying Bill, formerly known as the Terminally Ill Adults End of Life Bill, was introduced to Parliament by Labour MP Kim Leadbeater on October the 16th, 2024. Now, the bill proposes that terminally ill adults with a prognosis of 6 to 12 months to live may request medical assistance to end their lives. Now, the key provisions of the bill include some eligibility criteria requiring patients to be over 18 and diagnosed with a terminal illness and registered with a GP in England or Wales for at least a year. 2 independent doctors must confirm the diagnosis, prognosis, and the patient's mental capacity to make the decision. And there are safeguards in place which include approval from a High Court judge to ensure that the decisions are voluntary and informed. This bill was debated in Parliament for 5 hours on November the 29th. And the bill passed its second reading with a vote of 330 in favour and 275 against, which has allowed it to progress to the committee stage. Now, public support for this bill remains strong, with around 75% of people in favour of legalising assisted dying for mentally competent terminally ill adults. Now, proponents argue that the bill provides dignity and autonomy, allowing individuals to avoid prolonged suffering. But on the other hand, opponents of the bill raise concerns about potential abuses, the adequacy of safeguards, and the ethical implications of legalising assisted dying. Now, some healthcare professionals really worry about the emotional and moral burden placed on doctors who are primarily trained to preserve life. And there are also concerns that vulnerable individuals might feel pressured to choose assisted dying due to financial or social reasons, raising the risk of unintended coercion. For example, in countries where assisted dying is legal, there have been reports of patients feeling they are a burden on their families or society, which highlights the ethical complexities of ensuring true autonomy in these decisions. Now, as a veterinary professional, I regularly make decisions about euthanasia based on factors such as pain, suffering, and quality of life. And it's important at this point to recognise that the human model differs significantly because it focuses heavily on terminal illness. Now, in veterinary medicine, the presence of a terminal illness may influence decisions around euthanasia, but we do consider more immediate factors beyond prognosis, which include animals' pain and suffering, their overall quality of life and things like mobility, but also the emotional and financial implications for pet owners. Now, veterinary professionals often take on the role of the advocate for their patients and help to make compassionate decisions in consultation with pet owners. And euthanasia is considered a viable treatment option when it is in the best interests of animal welfare. However, dilemmas can arise. For example, when an owner's personal circumstances influence the decision. For example, a pet with a chronic but manageable and treatable condition may be euthanized if the owner can't afford ongoing treatment, whereas another owner with the financial means might choose long-term management instead. An increasingly common dilemma within the profession is the concept of behavioral euthanasia, particularly in dogs. Now, these animals are often considered healthy in medical terms, but their behavior may pose a threat to those around them. Now, experienced behaviorists may, with extensive work and time, be able to turn these animals' lives around, but for many, those resources are simply not available. Now, this inconsistency can create significant moral distress for vets who must balance the pet's welfare with the owner's circumstances. Now, during the pandemic, performing euthanasia was particularly distressing for me and other vets in the profession because pet owners couldn't be with their pets during their final moments. And it was this kind of awful experience that led me to set up Home Goodbye, which is a home pet euthanasia service in London, because I strongly believed that for pets in need, having a calm and compassionate end-of-life experience in a familiar place where they felt safe, surrounded by loved ones, was one of the kindest things we could do for a suffering animal. And the experience in the pandemic was far from that. I mean, we had to, due to social distancing rules, we had to take animals from their owners, often in the car park of the practice, and perform euthanasia without them being present, which was, from my perspective, really quite distressing. But in my experience of euthanasia, I often hear comments from pet owners like, I wish we could do this for humans, or, this is how I want to go. I want to pass away in my sleep at home. And that is, almost the benchmark for how people think about their own death, that they want to be somewhere safe. They want to be, potentially surrounded by loved ones, sometimes, on their own. But ultimately, they want it to be painless and not have any suffering. These sentiments usually come from people who have watched loved ones suffer through prolonged terminal illness or difficult end-of-life experiences in hospital settings. So all this brings us to an important question. Should vets have a voice in the assisted dying debate? Now, some believe that our experience in assessing suffering and advocating for humane treatment offers really valuable insights. And we are uniquely positioned to evaluate quality of life without the emotional and cultural biases that often influence human medical decisions. However, others argue that veterinary euthanasia can't be directly compared to human-assisted dying due to the kind of fundamental ethical and legal differences, such as patient autonomy and the rights-based framework which governs human medicine. So it's worth noting that to date, veterinary profession has not been officially consulted in the drafting or discussion of the assisted dying bill. And this absence is one of the reasons that I'm kind of recording this episode, to shed light on the unique perspectives that veterinary professionals can bring to this really complex issue. But I think it's probably worth just exploring some of the key differences between veterinary and human euthanasia. So the first difference is in criteria. Now, veterinary euthanasia is based on deteriorating welfare, so the presence of pain, suffering, and the deterioration of quality of life. Whereas the human-assisted dying is currently limited to terminal illness only, without explicit consideration of quality of life. So in that, a patient could potentially have a terminal illness of 6 to 12 months and therefore be a right candidate for consideration, but they may not be experiencing the pain and suffering, which in a veterinary perspective would lead us to make that decision. On the flip side of that, a human patient may not have that terminal diagnosis, but may be suffering from an incredibly debilitating condition, which is hugely affecting their their quality of life. In veterinary care, there's another important difference. In veterinary care, decisions are made collaboratively with pet owners. But in human-assisted dying, the individual retains the autonomy to make the decision. And there's another difference in financial considerations. Now, veterinary euthanasia can be influenced by financial factors, whereas in human healthcare, decisions are generally guided by medical necessity and patient autonomy, especially in the UK within publicly funded systems like the NHS. The other thing I wanted to mention is around some of the ethical considerations. Now, vets are accustomed to making end-of-life decisions, balancing empathy with medical judgment. But in contrast, doctors are primarily trained to preserve life, which really does for me raise the questions about whether doctors should be tasked with assisting in these end-of-life decisions. I feel it's an incredible burden to put on a profession who have been trained and who carry out their work primarily to preserve life. But again, that is part of a vet's job, and that's ultimately what we are trying to do as well. And that could indicate some of the conflict that we are seeing in the profession. So these decisions do make us a burden. And I know that firsthand, some vets really struggle with this part of their job. Some are even choosing not to do it, and they rely on their colleagues to step in. From a personal perspective, I've seen firsthand how welfare and suffering of animals can be prolonged when euthanasia is not considered as a treatment option. So whilst I appreciate that vets can conscientiously object to euthanasia, ultimately, in some situations, this may not be in the best interest of the animal. So in conclusion, I would say the assisted dying bill is really complex, and it's a very emotive issue. And it touches on really deeply held beliefs about life, death, and dignity. As veterinary professionals, I believe we do have unique insights to offer, but we must also recognise the significant differences between human and animal care. And we must also recognise the emotional toll that performing euthanasia has on our profession. Now, ultimately, I hope that the assisted dying bill drives us to create a really compassionate and ethical framework, one that respects individual autonomy, but really maintains robust safeguards. I'm also hoping, although it's not in the current bill, that there is consideration given to quality of life, which in a veterinary perspective is really important and one of the main driving reasons to consider euthanasia as an option. It's going to be really interesting to see how this debate continues, and I'd really, really welcome the thoughts and perspectives of others. Thank you for listening to this episode. You'll find all the relevant links to this conversation in the show notes. If you enjoyed it, please follow us and leave a review. It really helps other people discover the podcast. For more insights on topics like this, you can connect with me on social media at Dr. Paul the Vet, or check out my website, theconsultroom.co.uk.